Today we will talk about the other liver disorder that is called cirrhosis. The word cirrhosis comes from the French word for orange. In cirrhosis, the cells of the liver become fibrous and they have orange colored nodules which resemble the skin of the orange. That is how it is called cirrhosis. Cirrhosis is most frequently caused because of alcoholism or hepatitis C. Liver cirrhosis is a chronic disease where there is considerable damage to the cells of the liver and the cells are infiltrated with fat and they become fibrous. Cirrhosis causes anorexia, which is loss of appetite. There is epigastric pain and the nausea increases as the day goes on. There is abdominal distension or bloating, vomiting, and steatorrhea. Steatorrhea is excretion of fat in the stools. Jaundice, ascites, edema, and gastrointestinal bleeding. The end result of cirrhosis is the liver failure and leads to hepatic coma. The dietary management of cirrhosis is these patients require balanced diet with high calorie, that is 50 kilocalories per kg body weight. Normally it is 20 to 25 kilocalories per kg body weight. They should be provided with 300 to 400 grams of carbohydrate so that protein is spared, and the protein is 1.5 to 2 grams per kg body weight. Too much of protein in the diet will result in increased ammonia in the blood, and too little protein will reduce the healing of the liver. Then the fat should be given in low or moderate amount. Among the vitamins, the fat soluble vitamins and thiamine have to be provided because fat soluble vitamins are generally stored in the liver, so they have to be supplemented. Attention should be given to fluid and electrolyte balance. Since the patient may have ascites, that is accumulation of fluid in the abdomen, then sodium has to be restricted. And fluid restriction also is there, which may lead to hyponatremia, that is the sodium levels in the blood may go down. Other liver diseases are cholestasis and steatorrhea. The bile cannot flow into the small intestine, therefore the fat cannot be digested because fat digestion requires bile. So bile remains in the liver and this is called cholestasis. Fat is not digested and large amounts of fat is excreted in the feces. The feces become pale colored and foul smelling. This is steatorrhea. So proper care should be taken for the liver.